Hi, OAC community. Thank you for tuning in to Fresh Perspectives. On this episode, we'll speak with Michelle Green Rhodes. Michelle is a 10-time award-winning nurse, international speaker, healthcare writer, author, and executive coach. She is also an entrepreneur and the founder of the Color of Wellness digital media brand. Today, we are going to speak about health equity for women of color with obesity. Welcome, Michelle, and thank you so much for joining us.
Thank you, and good afternoon. Thank you for having me.
So to start off, can you tell us a little bit about yourself and your journey?
Well, yes, I'll try to find a place to start, but registered nurse, 25 years is where I usually start. People usually don't believe that, but yes. My background was actually on the business side of healthcare, so I've done managed care, which was really with insurance. So I've seen data when it comes to health equity and inequities, but also now, like you mentioned, ventured into entrepreneurship for the past just about 7 years to help share that information out to the communities that we serve.
Thank you for sharing that, and thank you for what you do. So I want to ask, does being a woman of color affect access to obesity care?
It does. It does. There's, of course, as we know, many barriers to access to all types of care. But now we've put two more layers on top of that. We've added actually three: woman, we've added the woman of color, and then we've added the obesity layer, which I believe is still, to me, from what I know, freshly new as a true diagnosis. So just being able to wrap our minds and even some practitioners' minds as to viewing this as a true disease, and then what that care looks like. So there's many layers that causes this barrier that we're talking about today.
Can you talk to us about the importance of understanding how race and gender intersect to affect the risk of obesity?
Well, so we can kind of peel those both back separately. When we talk about race, now we have to encompass many things that go along with that, meaning your culture, the cultural norms, habits that come along with the culture that contribute to obesity. Now, this is just with us talking about race and obesity, but many of the habits, which we know obesity is really compounded by our lifestyle and the choices that we make. So that lifestyle combined with those habits that we might have can lead to obesity. And then on the other side of that, we talked about the fact that we're women. So as a woman, now we have to consider the barriers on that side, of course. We have, of course, childbearing is the first thing that comes to mind, but with that comes the hormonal piece that I believe is a huge factor when it comes to obesity, and also being able to access the different types of care that helps us to keep those things in moderation. So what does that look like to really be on top of our wellness when it comes to our hormonal care and our health as a woman, being proactive in many screenings that we need, the ability to receive those screenings in a timely manner, which most times we see, for instance, with breast cancer, many African American women, they don't receive those screenings in a timely fashion. So by the time they are diagnosed, if there is cancer there, most times it's already set in and it's progressed to a later state when compared to white women.
Thank you for sharing those points, Michelle. Now, the Obesity Action Coalition, we are all about advocacy. So I want to ask, what do we as advocates need to do to ensure equity for people of color in obesity care?
Mm-hmm. The advocacy is so important, as we know. And one thing I appreciate about OAC, and I thank you all for the work that you do, is being able to carry the voice in the places that need it the most, meaning most times this is even a policy issue. So yes, we are sharing our information, the latest information with our communities, but it also needs to be taken right into the policymakers' hands, being able to take these to the Capitol or White House, wherever that leads to, and combine forces with healthcare providers, whether it be physicians, pharmacists, being able to come as a united front and share that advocacy voice to those who make the policies at hand. That really is the biggest piece.
Definitely. Thank you, Michelle. Is there anything else that you would like our viewers to know?
So many things, but I will just share before I leave that, first of all, thank you for this time today. I'll say that. I appreciate you just shining a light on this issue. But I would just really leave a strong message to our providers, our healthcare providers. Again, early as I mentioned, we're still wrapping our minds around the fact that obesity is a disease. It is something that needs the treatment, and the treatment is out there. And of course, we know there are many barriers on the other side of treatment, but I want to ask the providers that are watching to continue to be a voice, continue to be a light for the patients who do need these treatments. Don't, shelter them or put them in a box or anything. Just continue to be that voice, because without the voice, it continues to be unheard. So in order for us to break out of the mold and the mindset of obesity just being a careless issue or lifestyle issue, let's really take it to the next level and embrace it as a disease as it is.
Thank you so much, Michelle. Thank you for joining us today. We really appreciate you taking the time to speak with us about this important issue.
Thank you for having me.